What's up everyone? Dr. Jesse, Superior Physiotherapy and Performance. Today I have for you an exercise that's going to target our pelvis, our low back, and our hips. Okay, so if you're someone who's sitting a lot throughout the day, you like to be in the gym, deadlifting, powerlifting, you're a runner, a sprinter, or someone who just tends to have low back pain and hip pain in general, then you're going to like the technique I have here for you today, okay? It all centers around our pelvis. So if you think about our pelvis, it's essentially these two hip bones on the side of you here, and it makes kind of a bowl. I like to think of it as a bucket. And that bucket, depending on how it moves, it affects what's going on in not only our low back and our core, but also down in our hips below, okay? So if you look at me from the side here, pull my shirt up a little bit, you can see my back. If we think of our pelvis as a bucket as a whole, that bucket can tilt forward and dump out, or it can tilt backwards, like the bucket's tipping backwards, okay? Many people, and I've been there before too, we get stuck in this position where we're tilted forward, and we're walking around all day. Now this is a little exaggerated, but you could imagine if you're walking around here like this all day, you're probably gonna get some tightness and discomfort in the front of your leg here, and you may get some excess pressure and pain in your low back. Now add that to a loaded position, whether that's squatting, cycling, playing basketball, or going for a run, then you're gonna get even more discomfort and compression in that low back. So to do this exercise, all you're gonna need is a flat surface that maybe comes up to about your knee height, a little bit lower, and then I have a foam roller, which I'm gonna use. You can use a small basketball, a soccer ball, a soft kind of medicine ball, anything that is about the distance between your knees to keep your hips in line throughout the exercise, okay? So first what you're gonna do is you're gonna get down on the floor and you're gonna put your heels on that surface we talked about. Okay. Now we're in this position. If I'm looking down at my legs, I want to see a straight line from my knees through my toes and my knees to my hips, okay? So that's where the width of this item comes into play. You want to put that right between your knees and squeeze your knees together gently on whatever item that is, all right? Now on top of that, so we're squeezing our knees together gently, you want to pull your heels into the surface a little bit, so you're going to get some activation in your hamstrings in the back of your leg. Next, what you're going to do is you are going to try to activate your core and tilt that pelvis, that bucket, backwards like we talked about. So you will lift your butt off the floor, but keep your low back in contact with the ground. So that would look something like this. In this position, I want you to focus on your breathing. Try to hold this position for 10 breaths, okay? So it's one breath there. Holding that posterior pelvic tilt that we talked about, okay? Do that for 10 breaths. Many of you are gonna have some difficulty doing this exercise. It's an awkward movement to get with the pelvis. If you haven't trained it much. But what this is going to allow you to do, this exercise in particular, is train your muscles, your low back, your hips to kind of relax when you tilt that pelvis backwards. The ability to do this is very, very important for many things we do every day. You know, sprinting, walking, jumping, squatting, deadlifting. So if you want to be able to train your glutes and your backside effectively, you want to be as explosive as possible, as athletic as possible, you're going to need to be able to control your pelvis as well as have that motion in your pelvis. So go ahead and give this a shot. Like I said, do that about 10 breaths every day, see how it does. And find us on Instagram at Dr. J, Superior PT. Find us online at www.superiorpt.com. Follow us on Facebook at Superior Physio. And remember, when you feel your best, you perform your best.